number of patients come to us for implant therapy. And in fact, that's what we're known for the most at Coastal Jaw Surgery for some 32 years now. And we pride ourselves in being able to perform the various procedures that allow for implants, dental implants, to be placed in the jaws. However, a number of our patients come to us without adequate bone volume to place one of these implants, which is again nothing more than a titanium screw that will hold the crown ultimately for the procedure to be completed. So if in fact a patient comes to us and the bone is too short or too skinny or narrow, well, we have procedures to widen that bone or to make it taller, so to speak, and that's bone grafting. A bone graft can certainly be done at one appointment, and in fact, many times that's pretty much all that's needed. There are some select situations that mandate us to perform a secondary bone graft, just depending on the extent of bone volume loss, because in some very severe cases, we're not able to biologically build that much bone back, whether it's in width or height at one appointment, but that's very unusual, less than 1% of the time. We can certainly take bone from our own patient, either from the jaw or even from their leg. More and more, we've leaned to take bone from other sources, meaning we can actually make bone, or I should say we are able to graft bone in such a way predictably by using synthetic materials, cadaver bone even, cow bone. But even more impressively, in the last 8-9 years, we're able to synthetically, biologically grow bone thanks to growth factors that are made in laboratories. And once again, we prided ourselves here at Coastal Jaw Surgery in being the first in the Bay Area to embrace this recombinant protein technology, as it's called, and using a protein called bone morphogenetic protein, or BMP, rhBMP2 as an acronym. Healing time for many of our bone grafts is on average of 4 months, sometimes as much as 6 or 7 months. But most of the time, 4+ months is adequate healing time to allow these grafts to more or less what we call turn over, meaning they go through a transition phase from kind of a soft to a medium to finally a hard consistency that allow the implants to be more or less integrated within that bone volume. For more information on what we're able to do with bone grafting procedures, and if any of you require grafts that you've been told you need, we certainly are available to accommodate your wishes and desires, and you can certainly contact us at any of our locations via telephone or visit us online at coastaljawsurgery.com.